joining us for another Crosstalk. My name is Kevin Tachi, and this is yet another COVID-19 update as we have tried to bring you regular updates about what's going on with this. It's like a once in a lifetime situation. Folks from back in the day probably who are no longer with us could probably tell you about living through the Spanish flu back in 1918, 1919. Unfortunately, most of us we're not around for that, but we're living through unprecedented times where we're enduring something where we need to kind of work together and share information and keep you up to date because information changes from day to day. And we're fortunate today to be joined by the Board of Health Chairperson, Arlene Dias. She was with us a couple of weeks ago as we provided you an update. As of late, a lot of communities in and around the Commonwealth of Massachusetts are instituting a wear a mask. If you are going to go into a business, if you're going to be out and about, wear a mask. That's one of the things that we'll touch upon and some of the latest trends and discussions that are happening. Arlene, welcome to the conversation.
Good morning. Thank you.
You got it. So where do we stand today? Here we are. We're getting ready to enter the month of May. Where do we stand with whether it's folks staying home, whether it's wearing masks, maybe folks, maybe the town putting other things in place so we can help further flatten the curve?
So on Monday morning, we instituted the order of people having to wear masks going into any essential businesses. We tried to get the information out by putting it on cable, putting it on the town website, putting it on our Facebook page. I did go into one store, and during the time that I was in there, probably an hour, I ran into maybe one or two people that didn't have masks. And I happened to run into a gentleman as he came in and said, "Do you realize that you're required to wear a mask?" And he said no. So he kind of pulled his shirt up, did his shopping, and left. So there still are people out there that I think have been in situations where they've not had to go places and wear a mask. So this is going to be new for them. And I'm not even sure. I know there are local places that are selling masks where they're going to need to get them. And I have heard of where my son works, they turn people away if they don't have a mask. It's important because it's one of the ways we know we can stop the spread of this virus. The social distancing, wearing a mask, but the mask protects you, but it also protects the other person as well. And I think the more we do that and the longer we do that, the more we're going to be able to flatten that curve. I watch the numbers every day when the governor does his updates to see where we are in terms of new cases and has that number begin to drop. And it seems like it's going to take forever for us to get to 14 days with numbers dropping, because each day it seems as if the numbers in terms of positives go up. Hopefully the deaths will continue to go down. But I think we still have a little while longer. And I know the weather's getting good and people are sort of being tired of being inside. I'm trying to find little projects around that I should have done in the past, but hadn't done. I think I'm going to make my back deck my oasis. That'll be my next project so that I can just sit out there and enjoy without interfering with anyone, without coming in contact. I think as this goes on, the more time you spend isolated, every time you go out, you feel like you're putting yourself at risk. So that you have to do whatever you can. Continue to wash your hands, wear gloves if necessary, absolutely wear the mask, and social distance. I know that there's been some people in stores have not wanted to follow guidelines in terms of the aisles are set up so that the flow is one way. And I don't know if they don't understand how important that is and how that reduces your coming in contact with someone, or they're just people that don't care and they are not going to follow the rules no matter why the rules are in place.
How much can town boards or law enforcement do in regards to this? Is just more or less asking people to listen. We're not asking you to do something that we're not doing ourselves.
Right.
Is it how far can you go? I mean, could it be as much as a and I'm not just necessarily talking just Hanson, because I know that you have a lot of relationships in and around the South Shore, and I'm kind of curious as to what you might have heard or what you've been hearing as to methods to try to get people to comply, whether it's a fine or a written warning or something like that.
Now, the South Shore communities, the communities that I've been in touch with through the Emergency Preparedness Coalition, most have instituted the mask wearing. I don't think any of them have instituted a fine or some kind of punishment. So you just hope that you're asking people to do this. You're explaining the reason why you're doing it is to protect them and yourselves. And I don't really think there's a lot more that you can do. I have been in stores and have heard in stores people getting into verbal arguments about it because people are going the wrong way. And I can understand. I'm going down the way that I'm supposed to. You're coming toward me. You're more than we're 2 feet away. I don't want to be exposed. I don't want to be exposed because I work with a population that it would be devastating for them to get COVID. So that if I'm doing everything that I possibly can to protect myself, I expect you to not invade my space. I'm doing everything that I can. I'm trying not to infect you. I don't want you to infect me. So it gets more difficult to go out and shop safely if you have people that just don't want to follow the rules. And it makes us have to stay in longer. So, we have to get the numbers down in terms of people being exposed, but we also have to really know what's going on and getting more people tested. Um, so I think it's going to be, I know, the end of May, hopefully sometime in June, things will begin to soften up some, but it's going to take people really, really paying attention to social distancing, wearing a mask, doing everything that they can to protect themselves and the public.
I think it's worth asking you this, knowing that you're a public official in the know, knowing that you've been a health professional for many, many years, so you're not new to this. What are you hearing from state officials or state health officials in regards to a possibility of a spike or a second spike?
The information that I've seen is that the concern is if we don't get this down now, that we're going to have another
Surge.
resurgence, yes, in October and November. So we have to do everything that we can right now to lessen the spread of the virus so that we won't have in October and November COVID to worry about and the flu at the same time. And as difficult as it is, because people are going stir crazy right now, the longer we can distance ourselves, the less we're going to be able to pass this virus on. And then at some point, it has no one to infect. The part of the problem is there's so many unknowns about the virus itself in terms of how exactly does it spread. Why is it that some people are carriers and they don't get sick and they're out spreading the virus and they have no way of knowing? There's so much more that we need to learn about this virus, but we do know from the past and endemic, the things that happened, that they figured out certain things, the social distancing, keeping people apart, things that worked. And so we should look at the lessons from other pandemics that we've had and continue to try to find ways to separate people, isolate people, and not pass this virus on.
What are some of the conversations that you've been having in regards to town events? Let's not forget this is the time of year that we start hearing conversations about town meeting. Let's not forget that there's a shared high school, and I'm sure that you're going to have well over 200 seniors that are set to graduate. What are you hearing in regards to plans or putting off plans to hold town meeting or to hold large events until um, things are safe enough to do so, and even still have stuff implemented where there's some sort of social distancing still going on?
So I think town meeting, the date of town meeting has changed. And I think as soon as we get closer to that date, we're going to need to look at what's happening at that time. Is it safe for people to come into a meeting? Are we going to have to do a Zoom meeting? How are we going to be able to do this? And I think until we get closer to that date and can see sort of what's going to happen during the month of May, is it safe? I think the one thing, I think the overall thing is going to be safety to residents in terms of, is it going to be safe at time of town meeting for people to gather together? Um, and I think that will push how the meeting is going to have to be set up. And town officials are going to have to figure that out as we get closer to that date. But until we get closer to that date, we're a good month and a half, 6 weeks away. We really have to look at the curve. Has the curve gone down? Are we finding less people? Um, and then the follow-up people, um, when they are positive or they've been recognized as a contact, answering the calls when they get a call, asking them who they've had contact with. That is sort of one of the key issues right now, is we have tracers that are calling people that are either positive or have been named as a contact. People maybe not answering the phone or not calling them back, not recognizing the phone number. So we will be putting information out on the town website and on the town Facebook page and on WHCA of numbers that people can call if they have questions, or numbers that they'll be getting calls from, so they recognize that this is a call that's really important, that they answer and that they respond to.
So I guess it's worth asking, and I'm not looking for specific numbers, but just kind of generalization. How is the town of Hanson done in regards to the number of folks who have tested or tested positive, in retrospect to other communities in and around the South Shore? Has it been fairly positive that the numbers aren't as high as other communities, or is there any concern by your board?
That I looked at the numbers the other day. They usually come out on Tuesday, and Hanson had gone from like 24 to 44. Hanson is a smaller town, so when I look at other towns around it, their numbers can be larger, but they also have larger populations. So I think the number in Hanson is not that high, but that doesn't mean that there aren't people out there that are asymptomatic that haven't been tested. So that doesn't tell me that there's not a lot of COVID spreading around in town. It just means these are the people that have absolutely been tested. And in the beginning, 6 weeks ago, it was very difficult for people to get tests. So if somebody had mild symptoms and they weren't tested, you don't know that they're not continuing to shed virus, and giving it to other people. So I'm glad that our numbers are low, but I don't want people to think that because the numbers are low, that they shouldn't be cautious and that they shouldn't continue to social distance and wear a mask.
So I guess I would ask you is what I don't know what Hanson has for assisted living or rest homes or nursing facilities. Have you received any information from those organizations as to how they're doing? Because we know around the state that those are the susceptible areas for COVID-19, and fatalities are highest with our older population.
Right. So we do have an assisted living. The only other things that I would have concerns about, but I've not gotten reports that there's been any issues, is Hanson has a fair amount of group homes. And I think from the very beginning, they've been very, very careful in terms of their staff and their residents. And then we have elderly housing, but at least in the elderly housing, everybody's in their own unit. And I'm sure they were told to stay in their unit and only go out when they absolutely needed to, because they're all at high risk. So that hasn't been as big a concern for us because we don't have the nursing homes or rest homes.
Okay. Anything during this conversation that we haven't brought up, but you feel while we're here talking about it and sharing this information with our viewers, there is something that you want to share from, as a member of the Board of Health and as someone who is a concerned citizen in the community?
The one thing that keeps coming up whenever we have good weather, as good weather is, hopefully we're starting to get more sunny days, is people going out and congregating in large groups. Um, the Burridge area has been an area of concern because as soon as a sunny day comes, there's a lot of people there. And I think as long as you can maintain social distancing, um, that people should be able to go out and enjoy themselves on a sunny day. Again, I'm going to my back deck. I'm not going out walking, but but they need to be aware of other people, and they need to be aware of exposure. Again, I don't want to go out and expose anybody to anything, but I don't know when I walk past you, if you're not that 6 feet away, I don't know if you're somebody who's asymptomatic, who doesn't know that they have it, and you cough on me or sneeze on me. Um, and so they have to understand people's anxiety about, okay, I've been in the house, I just want to get out, but I don't want someone else to put me in jeopardy. Um, and so I think people have to take that into consideration and give people a wide berth when they're out walking. It's a huge area. There should be plenty of space for everybody to be there, but I think people need to be aware of how anxious people are and how at risk people feel.
Well, I want to thank you for taking time out of your schedule to chat with us and give an update. We'll look forward to having you on maybe as information comes out, as we get more details that are vital to sharing with residents, giving them updates, whether it's about the importance of wearing a mask, or if you are an organization, no matter how large or small you are, that, unless you're deemed essential, you should be practicing social distancing and find remote ways of being able to stay in business if possible. Any further information you want to give up? I think you kind of mentioned if folks want more information, they can definitely go to the town website. That's accurate, correct?
Definitely go to the town website. We have a Board of Health Facebook page, and we will be putting information on Whitman Hanson Community Access bulletin board as well.
Excellent. Well, Arlene, thank you so much for your time and your patience and your energy during this crisis. We value it.
Thank you.
You got it. And thank you for watching another episode of Crosstalk. It's important that during these times that we're in this together, just as long as we do it, we socially distance properly. If there's anything you want information when it regards to COVID-19, info@whca.tv is the way, and in the subject line, if it has something to do with Crosstalk and municipal focus, just mention so as to guests that you'd like to see on providing said information. Until next time, have a good day.